Good afternoon, hello, g'day, I'm Osher Günsberg. Welcome to WayAhead's Facebook Live event. We, today, on this stage, will be discussing the state of mental health in New South Wales. We're coming to you from the Parliament House in beautiful Sydney on Macquarie Street. This building's been around for longer than I've been alive, but this is where it all happens, and we're very grateful to be here. We'll be discussing the key issues regarding how mental health is administered and delivered throughout New South Wales, and indeed what the future looks like. During our broadcast, we'll be discussing some topics which some people may find distressing and some people may find triggering, and particularly if your microphone falls off in the middle of your Facebook Live. Remember, if we do speak of anything today that comes across at all triggering or distressing whatsoever, there is a great amount of help available. You can call Sane Australia on 1800 187 263. You can call Beyond Blue on 1300 22 4636, and of course you can call Lifeline on 13 11 14, or visit any of their websites to find out some more information about how they can help you. My first guest today is New South Wales Mental Health Minister, the Honourable Tanya Davies. Minister, thank you so much for being here.
Thank you, it's a pleasure.
Thanks for having me in your place of work. Do you like working here?
It's an amazing opportunity to be a part of a great team that are really making differences in the lives of people. And hello to everyone, and particularly people in my electorate, hello.
What about my electorate? What about Wentworth?
Well, hello to everybody.
Oh, thank you. What do you think is obviously this is you've taken on a ministry that's, it's not without its challenges. What do you think is the current state of mental health in New South Wales?
Well, I think what's really important to help everyone understand is that right now in New South Wales, the government is in the process of a 10-year reform of mental health. It has often been seen as the poor cousin to other mainstream health services. We are in the process of reforming that, transforming that. We've committed to a 10-year program that is funded to ensure that we are providing a holistic response to mental health services in our state. Particularly around strengthening community-based mental health services. We have an excellent health system in New South Wales. We have brilliant doctors and nurses, allied health professionals, but what we had been lacking was the community-based support system for people living or recovering from a mental illness. The evidence is out there that people with a mental illness, they actually live better, they live more healthier lives when they are connected in their community, when they still have connections with family, with friends, with their social network, with their workplaces. And that's why we are working hard to strengthen, to upskill, to build the network, the infrastructure, I guess the fabric of a strong community-based mental health system to support those people when they need it.
And kudos to you for doing something 10 years long. That's longer than an electoral cycle. And not many people are brave enough to go, yep, this might not be, I might still not be in this job and this will still have to go.
That's right, that's right. I mean, I've been the minister since January of last year, and my view is that you are literally given an opportunity to make a difference. And I've never been one to just sit in a job. I've always been one to, whatever I've been given, it's like put your 110% into it wherever you can and make sure that you make a difference for other people, work really hard, so when you can look back, you can actually pinpoint the changes and the benefits that you've delivered.
When you say there's a big reform in place, that's obviously because something wasn't working right. What aren't we getting right at the moment in mental health? Look,
there is, this year alone, our budget for mental health is $2.1 billion in mental health alone. Our health budget is close to $24 billion. So we are investing a significant amount of money into mental health services and systems. But we still have challenges. We still have, for example, the scourge of suicide. I mean, it is terrible. The rate of suicide in our state is double the road toll. Yet as a community, we don't talk about that enough. We're not brave enough to really tackle that challenge. Well, today we've changed that in New South Wales. The Premier, the Mental Health Commissioner and myself, together with yourself, Osher, we announced a strategic framework for suicide prevention with $90 million particularly targeted to suicide prevention activities. We have an awful amount of work to do to drag down this rate of suicide in our state. We also need to continue to talk about mental health, to break down the stigma. There are still instances where people feel stigmatised, they feel worried about the repercussions on themselves, either in their family or in their workplace, if they put their hand up and say, I need help. But people like yourself are so powerful, you're so effective in helping us change that stigma because you are courageous and bold enough to go out there publicly and say, I needed help. And when we have examples of people like yourself, successful people that young people look up to, we have people who are politicians, people who are business people, sports people, everyone from across every sphere of our community is touched by mental illness. And that when we continue to show examples of people like that, we continue to break down the stigma so that other people who are struggling with not being courageous enough to say, I need help, they can feel a sense of hope that, wow, if he needed help and he put his hand up, well, then it's going to be okay for me to put my hand up too.
It's extraordinary when you compare it to the road toll. I often like to say that if it was air traffic, if we were losing as many people to plane crashes, no plane would take off tomorrow.
I know.
No one's taking off today until we figure this out.
That's right.
And even so, if the road toll, if we said this many people are dying on the roads today, there'd be billboards everywhere.
Yes.
We don't talk about it. And I totally understand that. I mean, I certainly, it's where we are in Sydney, we're on Macquarie Street, which is like the fancy doctor part of town. And when I first moved to Sydney in 1999, it was just across the road here, actually, that I sat in a psychiatrist's office and he said, you need antidepressants. And I said, I don't think so, pal. And I've wasted about 9 years of my life just kind of gritting my teeth because I didn't want to, I know what that's like. I know what it's like to not want to have to take them. Don't worry, I eventually got sick enough that I needed them. And I took them to get a lot better.
I'm glad you're doing a lot better.
Yeah, me too. What if it's been a little bit of time since you've been the Minister for Mental Health? What have you learned most during that time?
Oh, and a number of key things really stick out for me. Number one, I never really understood how many people, organisations, non-government organisations, community programs, government programs, I had no comprehension as to the vast array of effort and support and programs and systems out there already, working hard, diligently trying to do their best to support people. The number of people that are giving their life to support other people, the carers who stand alongside people with a mental illness, parents, husbands and wives, partners, often give up their life to support their loved ones through their mental illness. That level of humanity I had no comprehension of, and I've been completely blown away by. I also understand that we still have a long way to go, and that's why the people that work really close to me know that I'm always looking for what else can we be doing, what else is innovative out there, what else should we be trialling, because the saying is quite common, you can't expect to be doing the same thing over and over again and get a different result. And so when suicide rate, for example, it increased, right, we need to do something different. And that's what I'm prepared to do.
So you mentioned the non-government organisations that work alongside and fill the gaps that the mental health system isn't able to cover. One of those organisations, of course, is WayAhead. What do you see the role of a non-government organisation like WayAhead going forward?
Well, I actually see their role becoming more and more enhanced, becoming more critical, like a flagstone piece of the whole system of mental health service delivery. There is so much need out there, and we need to support these non-government organisations further. We still have gaps in our system, so there's still opportunities for more people to come in to help us plug those gaps, to ensure that at the end of the day we can look out across our communities and see that we have an integrated, fully connected mental health system, all the way from the federal government, the state government, local government, right through to schools, workplaces, organisations, industries, non-government organisations, charities, everyone working together. A lot of that is happening right now, but we still have some missing pieces. And that's why a key component of the strategic framework for suicide prevention we announced today talks about working together, collaboration, knowing in your local community what is existing now, but what do you need that isn't being provided, and then working together to fill that need. Precisely,
because on a state, it's hard to comprehend, how do you create a policy or a solution that works for a landmass as vast as Australia, let alone a state like New South Wales, and indeed, how can a community like Wagga, for example, how would a policy that works in metropolitan Sydney or Newcastle be applied there? And what you're saying is that these two communities now have the opportunity to have slightly different approaches, whatever fits in with the culture and the community of where they are.
Yep. So through the work of the Mental Health Commission and the New South Wales Government, we've spent the last 6 months doing an extensive amount of consultation right through our community of New South Wales, talking to people who have attempted suicide, talking to people who are bereaved by suicide, talking to healthcare professionals, non-government organisations, to find out what do we all agree are the key principles that would, once implemented, go a long way to prevent suicide. And we've agreed on that, and that's what's in the framework. But the framework also allows a local community to customise it to suit their local community. So certainly what is needed in the inner city is going to be very different to what's needed in Broken Hill.
Absolutely, and what works in Broken Hill probably wouldn't work in the inner city, just by the very nature of how a community looks.
That's right.
In that situation, not to mention the extraordinary stars at night.
Yeah, oh, magnificent.
In Broken Hill.
Yes.
Oh my goodness! What do you think? What's your future focus when you're looking ahead? When you look, you mentioned a 10-year time frame. What's your future focus for the state of mental health in New South Wales?
Look, we really need to do more to support our community-based mental health system, and I want to see more effort in our early intervention, particularly reaching young people. We know that when someone reaches around the ages of 14 up to 25 years of age, that age bracket is where 75% of all mental illness will begin to emerge. So we need to make sure that we are investing heavily in that age bracket, because not only do I want to prevent people from having a long-term mental illness, but for me it's their life that they lose out on. It's their dreams, it's their aspirations that they will lose out on, that I don't want to see happen in these young people. So I want to see more effort being put into innovative ways to reach our young people, so that we can stop a chronic mental illness from developing.
And as you mentioned before, it's not, with 1 in 4 Australians affected by complex mental illness, it's not just the person who's suffering. It's the, as you mentioned, it's the wife, it's the husband, it's the son, daughter, the parent of that person, and the people that care for them. As you mentioned before, they often will put their own life on hold to care for that person.
That's right, and I'm always looking for ways. What else can we be doing? What other programs can we be supporting to help our community? And you could be alluding to the fact that we need to be looking more at what can we support in terms of the carers of people who are looking after those with a mental illness. And just a couple of weeks ago, we announced a pilot program with Batia to trial the showing of videos of young people who've gone through a mental illness in the Hornsby Adolescent Mental Health Inpatient Unit. So while young people who are admitted to a mental health inpatient unit are going through their acute mental illness, they will be watching videos of young people, their own peers, having gone through that process in that method, getting some hope back where they may not have hope. So I'm always looking for ways to look at innovation in terms of getting the message out there, making sure we reach people with the message of hope, with resilience, with we are here to help you whenever you need it.
It's important for any person in a position of power to walk the walk. What do you do in your own life? You have a very high pressure job. What do you do to make sure that your mental health stays on the plus side? What do you do as far as self-care goes?
Great question. I personally had a difficult patch between our two children. There's 9 years between our first daughter and our little son, Harry. Go the Harrys of the world at the moment. And that was a period of struggling to conceive and to carry a child through, to birth, and that brought with it an immense amount of anxiety and anger and internalisation of grief and pain and frustration, and felt extremely alone. Felt alone in the world, and it wasn't until I was actually in this role that I came to find an organisation called the Gidget Foundation, which is going out there to find women like me. And I think to myself, I had that experience where I carried that on my own and struggled for years with that. I will do whatever it takes while ever I'm in this seat to work hard to make sure that no other woman has to experience that. So I take a little time out in terms of making sure I eat well, keep up my sleep, try and have Sundays off with the family. But also in the back of my mind, I think I've only got a 2-year position right now in this as minister. That's short. So I want to make it count while I'm here.
very, very grateful that you chose to share that. I know it's a big deal when someone in your position shares something like that, but I want you to know that there's many people who are watching right now that have heard you say that. And exactly, they feel what those kids in that hospital you just mentioned, they're feeling right now. It's not just me. And so I'm very grateful that you're able to do that. And I'm so grateful for your time today. Thank you so much. I've had a really lovely day. It's been fun this day.
Yeah,
it's really good.
Has.
I'm going to say goodbye to you, but I'm going to have more people on in just a second.
Great.
So thank you very much.
Thank you,
Thank you very
Thanks
much
everyone as well.
Thank you very much for joining us, Minister. And to mark the start of Mental Health Month this year, WayAhead actually presented the 2018 Mental Health Matters Awards, and one of the awards is the Lived Experience Participation and Leadership Award, which went to the Wagga Wagga Mental Health Recovery Unit for their innovative model of care, which puts the needs of the person with the mental illness at the centre of the care that they receive. This is their story.
My name's Lisa Kemp and I'm one of the co-authors for our nomination, and my role in the Mental Health Recovery Unit is a peer support worker. I'm here to essentially role model what recovery looks like. Mental Health Recovery Program is an 8-week live-in residential program, and we focus on giving tools for people's tool belts so that they can help manage their own mental health out in the community. Some core subjects, things like assertiveness, self-esteem, living skills, cognitive behavioural therapy and dialectical behavioural therapy, just to name some of them. We have also what's called a recovery star, where people get to look at a ladder of change in 10 aspects of their lives where they might want to focus on goal-wise when they set their own recovery goals here in the unit. So Buddy's my dog. Buddy's also the recovery unit's therapist. He's a good listener. When someone was sharing their personal lived experience story, they became quite upset. He went straight over to them and sat with them and comforted them.
My name is Belinda White, affectionately known as Bill. I graduated from the Mental Health Recovery Unit in 2016. I came here after a particularly harsh meltdown and immediately felt support. The recovery unit is different. I've had experience with other mental health facilities, and this is the first place that treated you like you, not just a client or a patient, but a person. You were asked what you needed as opposed to being told what to do. We have our own spaces. You can come into that room, you can make it your own. You want to put your own quilt on, you want to put your own pictures up, you want to put flowers, fine. It's your space. Quiet areas, relaxation room, watch a movie, watch television. There's a piano, there's a couple of guitars. A big point of difference is access. It was really important for me to continue that connection with my family, to not just disappear for 2 months. Every afternoon I picked my little girl up from daycare. I had dinner with her. And when you leave, you've got the tools, you've been shown how to use them, and people start to realise that you're not just that unwell person. They start to see your person, which is such a cool thing. Like, it is such a cool thing. I've returned every week to run a creative writing volunteer course. It keeps me grounded, it keeps me sort of aware, and it also means that I get to come here and give something back because they gave me so much.
I'm Spencer, and this is my 8th week in the recovery unit. Prior to coming here, I struggled very intensely, and despite being medicated, it was a little tricky for me to live day to day. Walking through those doors was one of the most difficult choices that I've ever had to make, but it's been the best decision I could have ever made. I learnt how to control a lot of the anxiety that was stopping me from realising my true potential. In terms of facilities, the gym was a great place for me to be able to just get physical and get out of my mind. Other facilities that I really used while I was here was the mindfulness room, in which it's okay to sit and be quiet and just be. The entire program here I've led the way. My weekly review points, I would conduct those reviews. I was in control of those reviews and I led those reviews. It adds to the sense of self and empowerment and agency that I felt while I was in here. It is phenomenal to think about the man who entered this facility as opposed to the man who was exiting. My wife gets to have her whole husband back. My son gets to have his whole father. It's not just me that this is positively impacting, it is everyone around me. The mental health recovery unit saved my life. I didn't see a future for myself before, and now I can't imagine not having a future.
Hi, welcome back. We haven't been anywhere. You've been where you are. We're still here at Parliament House. This is Facebook Live, and I'm very grateful to be here because joining me now is the New South Wales Mental Health Commissioner, Catherine Lourey, and WayAhead CEO, Liz Priestley. Catherine and Liz, welcome.
Thank you.
Thank you so much for being here. It's been a cracking day. Let's start by getting a bit of a better understanding about what the Mental Health Commission and WayAhead are. Catherine, could you kick us off? What's the New South Wales Mental Health Commission?
The New South Wales Mental Health Commission, well, it's a really interesting place because the Commission has a role about changing lives, and that's a privilege to be in an organisation that does that. So we're one of those organisations that we're government, but we're also a bit of a watchdog on government. So if you want to tell us you're going to be doing something about mental health, we're going to try and keep you at your word. So our role is about listening to people with lived experience, the nurses, doctors, the community, and taking all of those voices together, listening to the experts and the evidence, and then putting that together and advising government on where we need to go. So it's really about a shared journey on reform.
I love that word. It's a very reality television word, journey, but I'm a big fan of it. It works very well.
Well, it's true because everyone's life is different, isn't it?
True.
You know? And so if I'm out talking to people in Armidale or if I'm in Liverpool, their journeys and their daily lives are affecting them, their families, their work colleagues. And it's never a one size fits all. Our daily lives are important to us and how we contribute and what joy we get out of our lives. So it is a journey.
And indeed, it's every little stitch in what makes the great fabric of our community is the quality of those daily lives. One by one is what makes us a city, a state, a nation, if you will. Liz, if you could be so kind, if people aren't aware of WayAhead, could you be so kind as to explain what WayAhead do?
Sure. Well, actually, can I just also say that the theme for Mental Health Month is Share the Journey. So it's a lovely little sort of connection between that. Look, WayAhead is a small charity funded by the Mental Health Commission. Can I just mention that here? Look, it was formed in 1932, so we're the second oldest mental health charity in New South Wales. It was established as the Council for Mental Hygiene, which is interesting language and how language has changed in the area of mental health, and probably for the better, I think. We do various things. We have also moved, so over that period of time, those 80 odd years, we've moved from mental illness education with a very focus on the critical end, moving much more to mental health and well-being, which is we've seen a shift in the way people think about mental health, because it's also important to understand that mental health is not the absence of mental illness. Mental health is really a whole community approach to well-being, and that's the focus that we're now looking at. But we do things. One of the main things we do obviously is mental health promotion, which is Mental Health Month. We do Postnatal Depression Awareness Week. We have a fantastic program of mental health and wellbeing in the workplace called WayAhead Workplaces, and that's a network of organisations and individuals with a passion for mental health and wellbeing in the workplace, and it's really taken on, and we've been doing that now for about 10 years, I think. The biggest part of our working with clients or with consumers would be in the area of anxiety. We run support groups for people with anxiety, including OCD, and we go into schools talking to parents and teachers about early warning signs of anxiety in young children, only in primary schools, not in high schools. And we also run public forums on using clinicians and people with lived experience in public. And we go to country areas and we get 200 people turning up on a weeknight in the cold sometime, just wanting to know more about anxiety. So that's the main part of the work we do. Oh, we do have an information service too, which is a database of mental health services and related services, and there's 6,000 of those more than 6,000 that we've got listed on that database that's available to anyone to access.
Yeah, so at what point in someone's, if they're experiencing an episode of mental ill health or someone in their family is, at what point does WayAhead come into it?
A lot of the people we do get are relatives, carers who are concerned about someone that they love.
Well,
and
it's
they
scary.
And they don't know where to go.
You don't know what's going on, yeah.
Well, I mean, look, I've been working in the area of mental health now for a couple of decades, and the system is complicated. It's complicated for me. So for anyone that doesn't know anything about it, to find really where you go, where is the best service without being transferred from one service to another, it's nothing worse than that happening, and that's been happening for a long time, although it is getting better. People's more services are available, actually promoting themselves and making it clear to others as to what they do. But a lot of it is carers, people that phone up, but other people too who are just ringing up about themselves because they're concerned about their own mental health and they want to know where to go.
Catherine, as the New South Wales Mental Health Commissioner, what's a day look like for you?
A day looks like for me, well, it's normally a pretty busy day, but a really exciting day, and they're days where you're forever learning and listening, you know, and so a typical day for me could be meeting a community group and talking about a particular issue or listening to what their concerns are. It could be meeting with a government agency about what they're doing about mental health, so it could be in their workplace. I could be chairing a committee that is looking at reviewing medications in mental illness. So the role of the Commission is around or across all of the community, right, and all of government. So you're forever trying to take all of those different places and aspects of people's lives and bringing them together into some cohesive narrative or some piece of information that you can share and build the understanding, the knowledge base, and therefore to get really good traction in that change process.
At the same time, keeping an eye on the people that promised they would.
Exactly. So, you know, we are actually established under a piece of legislation of government. So we are a creature of government. But definitely, like, our role is about advocating for good mental health. It's about supporting and improving the mental health and wellbeing of people of New South Wales, and about reporting and monitoring. And I think that's the real key. You know, it's if you make a commitment about what you're going to do, everyone wants to say, well, has that touched my life? Has my family got better access to services? Has the person that I love, you know, have I got better housing? Because we know that mental health isn't just about illness, it's about, do I have a job? Am I connected to my friends and my culture? Have I got safe and stable housing? Can I stick to university and my other studies? And that's what the Commission's interested in, the whole person.
Yeah, and like any episode of ill health, say if an example would be to break an arm, break a leg. It's like, okay, what's my pathway from this to getting back to work and being able to, you know, engage with my family and my friends and, you know, be a valuable person in this community, in our society. But similarly, because it's something that we can't see, it can be a little tricky though, can't it? To explain to people why it's important to seek help, but also to have compassion for someone who needs help. Isn't it? Would you say, Liz?
Yes, almost. It's interesting too. You've just reminded me, when I first started working in mental health, my CEO at the time, I knew nothing about mental health, by the way. I just sort of got into that as an accident. And she said to me that, you know, you're going to know when you make a difference, or when we as a society and community make a difference. When somebody goes into a psychiatric unit and needs to be hospitalised, that we automatically send flowers, that we visit and we send flowers. Then you know we've got somewhere, and until then, we've still got a long way to go. I think we're a little bit better at it, but I still think we've got some way to go. I mean, automatically you just send a bunch of flowers.
The grey in my beard betrays my age, but I certainly I'm old enough to remember at a time when, I know it's a different illness, but when a cancer diagnosis meant that people almost didn't speak to the family. That was it. We don't talk to them. No. It was almost like that people just would isolate the family because it was so frightening to speak of. But now, thankfully, we're able to speak about all these things so much more and indeed support the family. And what you're describing there is a similar path to, it's just another thing.
Exactly. And it's also people feeling more confident to be able to talk, because often people won't ask questions or talk about it because they're scared of doing harm. But the more we educate everyone else, you know, you're not going to do harm. In fact, you're going to do good. You ask, people will really be happy to ask how they're going.
Catherine, when you look look forward to the next 12 months, what do you think the focus of the Commission is?
Well, the Commission actually can do a lot of things. So obviously being focused is important. So one of the things that we really are looking at is around distress in the community. We're talking about, reaching out. It's about reaching out to people, but remembering the flip side of that is also stigma and discrimination. If you want to reach out, you should have an empathetic, compassionate response at the end. We shouldn't have people who are withdrawing from you if you do reach out because they have a misunderstanding of mental illness and stigma. And I think that's one of the key things that the Commission is really wanting to work towards. We're also really interested in young people. And so we will be really setting up how we're going to be engaging with young people and also with other communities such as the LGBTI community. We really want to strengthen that voice that comes into us, and that's going to be a real focus because the strength of the Commission's work can only be about the advice and the engagement that we get with the community, because at the end of the day, our work is for the community.
Exactly. And when it comes to the way ahead perspective, Liz, what are you seeing as the areas of need within the community?
Well, just recently with us, a couple of the things that we're focusing on, after speaking to some consumers, they talked about the problem with hoarding. We hadn't thought about hoarding. We know it goes on and it gets some media, usually bad media, both in reality television shows and also to front page of the Telegraph. So we wanted to look more into what hoarding was and to what sort of services are available for people with hoarding issues. So we got in touch with some people, and we've been advertising for forums, and this week in fact we've had 2 forums that were full of people to attend, wanted to know more about hoarding. We've never had that reaction before for anything that we've done, so it's amazing. And the rest of the week we're running workshops for people who want to work with people with hoarding disorder and then start making a difference, and it's been amazing. We just didn't realise there was that much interest in hoarding.
Well, it's certainly a thing that affects not only the person who's got the mental episode of mental health, it affects those around them. Like, for example, if someone were to be hospitalised, can you go home and keep my favourite jumper? They open the door and they call them goat tracks, the little goat track between all the piles of things. It's very, very impactful on the family member to come and then suddenly see how that person's been living, and then it's very difficult to get that hoard out of the house because it's an external symptom of what's going on inside them.
And I have learned this week that actually just getting rid of the stuff, clearing the house does not work. In fact, it makes the situation worse, and we need to address it in a completely different way. We need to change the way that people who are hoarders, how they actually perceive the things around them, and we need to address that and help them address how they perceive that. So it's been a really interesting process for people. I mean, hoarding can make people homeless. You can get to a stage where you lose the home around you. It can stop you having a full-time or working because of the amount of hoarding you even have in your own workplace. So that's one thing. But the other thing that we've noticed is that we've started working with a group. It's a coalition to end loneliness. So, which sort of attracted us, and we thought, gee, that's good. And every time we mention loneliness to people, people suddenly engage. It's a word that they hear used in very many situations, but they don't think about it. When they start to think about loneliness in the sphere of mental health, it becomes different to them, and they really want to engage with it. And I've been doing a bit of reading about it, and loneliness has physical consequences. And research in England has shown that it's equivalent to having 15 cigarettes a day is the impact it has on you physically by that. So, which is fascinating. Blood pressure, a whole stack of things that can happen. But it's so easily to address.
Yes, isn't that interesting? There's such an easy intervention to deliver to someone who needs that help.
One thing the coalition is doing now is trying to get GPs to screen for loneliness. So when you're going in there, the GP will ask you, look, are you lonely? That's fine for the GP to ask that, but then the GP needs to know where can they actually take people or send people to address that loneliness.
Well, both of you are in these very important roles within our community around mental health. Let me ask you first, Catherine, how do you care for yourself?
How do I care for myself? Well, very luckily I've got a dog and a cat. So hello Amber, hello Ruby. I also have children. Hello Jasper, hello Imogen.
You said hello to the pets before you said hello to the kids.
I know, but hey.
That's fine.
No, and my husband, hello John. But so there's the pecking order. But look, it's a sense of humour. You've got to have a sense of humour in your life.
Yeah.
And for me, it's also music. I love music, and at the end of the day, I will put some music on, and that can be at the end of the day in the office, I can have music, or when I go home. And for me, that just centres me and just gives me a space to go to. So, and you know, I'll go walk the dog, but for me, it's about finding that space, you know, that quiet space. So,
well, it's super important to have those things, because if you don't look after it, it can build up. And it's so important that you have that habitually every day. That's really good. And what about you, Liz?
Well, look, actually mine is very similar to Catherine. I have 3 cats. So I love my cat. I have my husband and my daughter. I have both the cats and the husband and the daughter at home. I love it when they're not home for a while. I love it when they go out, and I've got a couple of hours to myself. I think that's wonderful, and I love to laugh.
Yeah.
I watch all the comedy shows on television that I possibly can, and laughter is always, to me, has always been absolutely amazing.
Yeah.
I have my garden, and I'm allowed to do a plug. I watch Judge Judy. I'm allowed to say
You
that.
do whatever you want.
I watch Judge Judy because she takes out all the frustrations out of me, and I leave that show, I tape it every day, and then I watch it at night, and then I go to bed feeling that all my frustrations have gone. Because she screams and yells, and I don't have to do it. All the frustration she takes out on all the people in that terrible show, and it's just wonders. So
Whatever
it does
gets you
wonders
through
for
the
me.
night.
It does wonders for me.
Whatever
From now
works.
on, I'm going to watch you on television.
No, I don't scream and yell. I whisper too much. I won't get any of your frustrations out. But I'm really grateful that the both of you have some strategies in place, and that you recognise the need to have those things in your day. And
Most
they are
definitely.
things that you don't need to see a doctor for, you don't need a script for, and they are within your control. Because it is when you take control of these things that you start to feel a bit more power about you.
But it's also knowing when you do need help too.
Absolutely,
Yeah.
very, very important. I'm so grateful that you both came here today.
no, it's been good.
This has been really good. It's been really good. I have one more guest. I'm going to bring him out. So you're going to stay here, but I'm going to bring one more guest out. Before we bring him out, our next guest is Allan. He's an extraordinary man. I'm going to show you a video which basically takes you through his experience. Allan Sparks previously served for 20 years as a frontline police officer. His work in the police force had an impact on his mental health, and he became quite seriously ill. Fortunately, Allan was able to turn his situation around, and a reminder that if anything in Allan's story distresses or triggers you, please do reach out for help. You can call Sane Australia on 1800 187 263, Beyond Blue on 1300 22 4636, or of course Lifeline on 13 11 14. This is Allan's story.
Life was, for me, very, very enjoyable. I was playing sport to a pretty high level. I was successful at my work. I had a great relationship with my wife and my daughter, and the future was looking fantastic. For me, it was because of the work that I did. I'd been a police officer for many years, involved in some quite horrific events. And like all emergency services personnel, those events do ultimately take their toll on you. I think for those in the armed forces, in the emergency services, police, ambulance officers, and like industries, it's critical to recognise that traumatic events that you are exposed to, there's a strong likelihood that they are damaging your body and your mind. So it's a matter of being prepared for them and the symptoms that you may exhibit, and taking steps early. Post-traumatic stress, to me, was like a never-ending replaying of events in a DVD that was going over and over in my mind. The traumatic events and the things that I had seen, the things I had been involved in, were just continually in my vision, whether it was during the daytime, the night time, trying to sleep. These events were just going over and over and over again. And eventually it got to the stage where I just couldn't sleep because I just couldn't close my eyes. I couldn't keep seeing these things. And that lack of sleep led to physical health problems because of the sleep deprivation. And those physical health issues in turn worsened the mental illness issues. So it's like you're reliving those moments 24 hours a day, and there's just no escape from them. And you become so anxious about what's going on, what has gone on, and you become so anxious about your future. For me the idea of being a man was the work I was doing, the sport I was playing, the roles I had in the community as far as my community involvement. I felt that I was as a worthwhile human being, and I wanted to be that strong, powerful person that I believed I always had been. I believed that I wanted to be able to contribute like I always had done. So suddenly there was this overwhelming sense of complete worthlessness, that I could not do anything that I could feel worthwhile about. I felt as though I was a complete and total failure. I felt I had nothing left to contribute. And again, there was just this sense of hopelessness with my situation that I believed I could never ever recover from. I didn't use alcohol, I abused alcohol, which was one of the biggest mistakes I made. I was drinking significant amounts of whiskey every night to stop the horrors coming back into my mind, to try and get some sleep. And it was the worst thing that I could have ever possibly done. So all I can say is, if alcohol is a problem, that has to be dealt with separately. But if you are tempted to use it as a form of self-medication, don't do it. The lowest point in my life was the day that I decided to kill myself. At that stage, I felt that I was unable to escape the trauma that I was experiencing. I could see no way out apart from taking my own life. Somewhere in deep inside me, I just had this hope that I didn't have to do it. And it was when I had given my gun back to a workmate, and that was essentially the day that I knew that I had to get professional help, because if I didn't, then the consequences were going to be catastrophic. So by doing that, I was then taken before a crisis counsellor, and the following day taken to a psychiatrist for crisis care and assessment. And that was the first step that I took that led me to where I am today. Medication was something that I hadn't really comprehended because I didn't know anything about it. The things that helped me as far as the medication and other treatments was concerned was that by me being prepared to go to a psychiatrist and be there and get treatment, my wife was aware that I was trying to get better. It gave her a sense of hope, which was so critical for her. Once the medication started to take effect, she could see that I was starting to stabilise. And she also then had hope for the future, which was critical for her. The first things for me to try and recover was accept that I had illnesses, and acceptance that I needed to do things to get better. Walking into the door of the psychiatrist was a challenging experience because, again, it reinforced the fact that I had problems. But accepting it and then taking proactive steps myself to plan for the future, to set goals for myself. And they were only little goals. They were probably might be what I could do for the next hour, the next half day, or the next day. They were just little goals that I could set for myself, and they gave me a sense of achievement. I described it as being like Humpty Dumpty, and you fall off the wall and you shatter into 1,000 pieces. Slowly but surely, setting those goals and achieving them allows you to put those pieces of yourself back together again, and it starts to make you feel stronger. And as a man, to have some sense of getting your strength back, and for me, your pride was critically important. Exercise for me was always very important. I loved playing the sport. I loved training hard. I loved being pushed. And the advice from the psychiatrist was that if you're able to get back into starting a good exercise program and build it up to where you once were, then the benefits will be exceptional. And they were. And I still train regularly. I try and maintain the best physical health I can. I drink in moderation. I haven't smoked cigarettes for 18 years. And I try and diet well. So for me, good physical health also can assist very good mental health. I think that for you as a person, you need to find things you're passionate about, things that matter to you. And because of what I've suffered over the years, and because of what my family has suffered, I like to get involved in community projects where I can give something back to maybe try and help people. And it's again that sense of worth I discussed before, that you need to find things that make you feel good about what you're doing. and certainly community involvement, volunteering for good causes is a wonderful way to do that. I would have to say that my greatest sense of achievement was being able to sail across massive oceans with my wife and my children and another young crew member on board was something that I never ever thought I could ever achieve. It had been a lifelong goal ever since I was a child, and for me that was the absolute ultimate that I could do to give me back everything that I had once lost. And it made me feel as though that I could do no more, I could ask no more of myself. And it takes a lot of hard, determined time and effort from you, the support of your family, but if everyone strives for those goals, you will get better and you will overcome it.
And Allan joins us now. Allan, thanks for coming here.
Great to see you again, mate.
Mate, it's super good to see you. You are a very influential person in my life. Allan was actually the man that said, mate, I heard your story, you should write a book. So I did. So thank you for that.
And very grateful for the copy I received today. Thank you. I saw it yesterday in a bookstore.
Right.
I remember that. Good news.
Well, I'm really grateful because you heard me share my story and you came up to me afterwards and you said, you'll help more people than you can possibly imagine sharing your story. We've just seen your story. What's it like for you when you watch it back, when you see your own story reflected?
It's quite unusual actually, because that film was taken probably 4 or 5 years ago now, when I essentially first became an ambassador for Beyond Blue and started on this crusade, so to speak. So I think now it's like, yeah, I can relate to that, but now I'm blessed the fact that I now know so much more about the why factor. Why did I become so unwell and why did I become suicidal? So it's essentially, it's looking at a bit of a time capsule. There I was, talking about where I was, and now I'm here looking back at all that aspect of my life.
Yeah.
And I'm so grateful that I have the opportunity, to be able to reflect and analyse and learn, and then transform that knowledge now to assist other people to understand why they may become as unwell as I did, God forbid, and how to intercept that progression from going from being really healthy to being in a state of acute distress, suicidal and the like.
And I guess as well, I don't know for you, but certainly for me, when I was writing the book and I was going back through all because I'm a voracious writer, when I'm going through anxiety, I tend to write everything down, and I kept all those journals, and I'm looking back at some of the things that I would write down, and I look back and go, wow, even though I thought I was better, look, like now I feel so much better. And that, does seeing that make you feel again like, and even further, how far I've come, how much more I've healed?
Absolutely. And it's also made me realise that as the Mental Health Commission, I mean, it's our responsibility. We have the responsibility for 7.5 million people in New South Wales to live well. So if I am going to be a representative of the Commission and a representative of the government and the Governor, then I need to walk the walk, perhaps more so than other people. So it's very important that I do live really, really well, and my health is the best it can be, even though I've got a bit of a head cold at the moment. And I then utilise the knowledge that I have to help others live well.
For people who are watching and they just watched what you've seen, what was it like for you? When did you realise that something was wrong?
In hindsight, I realised that I was chronically stressed or developing chronic stress, probably around about 1994. So 1993, I'd just come back from 5 months cycling around Europe with my wife on our honeymoon. We rode 6,000 kilometres around Europe, up and over the Italian Alps, through Norway.
You're talking my dream here.
So I came back like physically and mentally absolutely fantastically healthy, as was my wife. 3 years later, I'm walking into a bathroom to end my life. So I wanted to know, why did I end up that way? And that's what I know now. So I look back and I think, about 1994, I started to become chronically stressed. I'd gone from super healthy to being stressed to chronically stressed. Some terrible events occurred in my police career, which I now realised started me on the path of the symptoms of post-traumatic stress disorder, leading into full-blown post-traumatic stress disorder. So I can just see how that developed. And had I have known then what I know now, I believe I would have been able to intercept that progression and taken steps to pull myself back. So it's a very defined timeline in real terms. I originally thought that being in the police force and being exposed to traumatic events for so long had a cumulative effect. Yes, I can see that, but it was certainly in that period of 93 to 96, I became chronically stressed like I'd never experienced before in my life. And I think that's something we need to be very cognizant of.
What things were happening that you noticed that something was different?
Factually, my workload increased dramatically in relation to the specific investigation I was doing. There was a lot of conflict in the workplace because of the actual investigation I was doing. And then that started the process of my exercise regimes changed, my sleeping habits changed, my diet changed, those things. So I was coming to work exhausted. I was living on coffee, cigarettes. Because of the conflict, I was using alcohol as a form of self-medication, eating terribly, all those sorts of things. So those things contributed to an acceleration and an amplification of the chronic stress I was feeling. Yeah. The merry-go-round started, and away it went.
It gets faster and deeper.
Yes.
Yeah, absolutely. When you were unwell, what was it like for you to ask for help and indeed to accept that help?
It's terrifying. I think that's perhaps what we're failing to understand, unless you've actually experienced it, that people have a perception all you really need to do is ask for help. Well, when you're trying so hard to suppress the symptoms of chronic stress, PTSD, depression, all that, when you're actually suffering from those symptoms, you are just trying to not be reminded in any way what you're going through. To actually recognise you need help and want to ask for help means you have to expose all of that. You have to open yourself up. And it's essentially like tearing your soul apart and saying, here it is. It's also a feeling of, well, I can't cope. So you have shame, guilt, all those factors come into it. So it's very challenging for most, particularly men, to say, I need help. But so therefore for me, we have to change the way in which we are able to allow people to identify where they are when they're in a state of mental ill health or mental illness in a different way. And it's so heartening to hear from Catherine and from Liz and from the Minister today about let's be bold, let's be brave, let's do things differently. You know, things haven't worked in the past, let's go way out there where we have to. And that's what I find very exciting, that we are on the cusp of significant change.
What would you say to someone who's either got someone in their life who's suffering and hasn't yet sought help, or someone indeed who's watching going, yeah, that sounds like me? What would you say to them about seeking help?
I believe that for me, from an analytical perspective, for every minute I delayed getting professional help, it cost me an hour of recovery.
Right.
So I knew that I needed help, but I was terrified to identify that I needed help. The stigma of mental illness, certainly in the police force, was that if you identified you were suffering from some form of mental distress, your career would be finished. Somehow we have to educate people to understand that, yeah, people are going to become chronically stressed, they'll develop mental illness, but that's not a death sentence, that's not a life sentence. We can bring that back. So it's an education process to allow people to, as we do, as you and I do, say openly and honestly, yep, we're in a bad place or have been in a bad place, but you can recover from it.
You are the Deputy Commissioner for the New South Wales Mental Health Commission. What does that role mean to you? What attracted you to the role?
Well, I still shake my head sometimes. I think, like 20 years ago I was in a psychiatric unit with no hope of getting through tomorrow, to here I am with, as explained today, under the Mental Health Commission Act, to the Deputy Commissioners, must have lived experience of mental illness. So I fit one of the roles there. I'm extremely honoured to be in that role. It allows me to give back, to use my knowledge, my experience to help particularly people who are very close to my heart, the first responders. They're my cohort. I have a very strong engagement with the New South Wales Police Force in relation to assisting police officers not go down the path that I went to. But I ensure that as I said, I walk the talk. I live really well, and I do what I need to do to be able to continue the changes we need to make.
I'm grateful that you do look after the first responders, because as a society we get to live a life of so much freedom in this country, because we know that at the end of the 000 phone call there's someone there who's highly trained that will come and save us.
Yes.
And who's going to save us if those people aren't able to look after themselves?
Absolutely correct.
So without a doubt, I'm tearing up thinking about how much we need to care for those people who do those jobs. I'm really grateful. Final question for all of you now. I asked the Minister before, where would you see, like in 10 years' time, let me start with you, Liz, in 10 years' time, what do you hope the state of mental health in New South Wales is?
Well, look, I think we've come a long way in 10 years. I think we're on the journey, on the path in the right direction. But I gave this little bit of thought, and I thought what I'd like to see is that we can actually prove that people are enjoying their life. They have a greater ability to enjoy their life. And that is not fearing the future or ruminating about the past, but enjoying the here and now and enjoying what's happening. I would like to see a society that has higher levels of resilience. For some reason, some people have high levels of resilience through luck, just luck, others don't, but you can learn to be resilient, and I'd like us as a society to be able to help people to build those levels of resilience. And I think probably most of all, I'd like the society to publicly be compassionate and accepting, much more so than they seem to be right now. We talked about stigma and about breaking down stigma and reducing stigma, and I noticed that the Minister at the launch of Mental Health Month said she doesn't want to reduce stigma, she actually wants to eradicate stigma. And I thought, yeah, I've been using reduce too long. I should be pushing for eradicating it completely. So that's what I'd like to see in 10 years' time.
What about you, Catherine?
Well, I just really believe that in 10 years' time, people should have the opportunities to lead the lives they want. And that means a life without distress, a life where when things get tough, they can not only reach out, but people will be there to support them. That they can have choice about what they want to do, which means even if you're unwell, you have a choice about where you get that care and who you get it from. And that when you reach out, you have people who are compassionate and who have empathy towards you, because it is that human connection. So it's about having a caring society, but it's about having opportunity. It's about just having equity. And one of the things we haven't touched upon in our conversation is that people with severe mental illness die 20 years younger than the rest of the community. Wouldn't it be great that in 10 years' time we start to see that shifting, because they're getting the right physical health care and they're getting the right medication and they're getting the right support? I think that would be brilliant.
What about you, Allan?
Yeah, challenging question, Oscar. Sure, sorry, Oscar.
Mate. I won't be grouchy.
I would love to see holistic education be part of our syllabus. So, as Tanya touched on today, the crisis involving our young people from 14 to 24, I'd like to see our children, even at the age of preschool, being educated about the importance of sleeping and diet and exercise. That becomes part of life. And in 10 years' time, I'd be very happy if we didn't have a mental health commission. I'd be very happy if we didn't have a Minister of Mental Health, that mental health was not an issue. Just we knew how to look after ourselves, and we didn't have people who were mentally ill. And if we did, then we had the resources, the clinical resources, freely and readily available to help people at the instant they need help.
All three of you have given us an extraordinary vision. It sounds very wonderful, and I'm very grateful that you're all doing your jobs to help us as a community. That's it for us. Thank you so much for watching this Facebook Live. Thank you very much to my guest tonight, New South Wales Minister for Mental Health, Tanya Davies, New South Wales Mental Health Commissioner, Catherine Lourey, Deputy Commissioner, Allan Sparks, and of course, WayAhead CEO, Elizabeth Priestley. If there's anything that you've seen tonight that is a bit of a trigger or makes you feel a bit weird, that's fine. Make a phone call. You can call Sane Australia on 1800 187 283. You can call Beyond Blue on 1300 22 4636, or of course Lifeline on 13 11 14. Of course, you can also visit their websites to find more resources and how you can get help. Thank you so much for watching. We'll see you next time. I'm Osher Günsberg. Bye bye.